Okay, Michelle and Kayla, are we all set to begin?
Yeah, I think so.
Okay, perfect. Well, welcome everyone. Thank you for joining us tonight. Before we get started, we have a few housekeeping items we'll like to review. So tonight's session is being recorded for educational purposes. If you are interested in viewing the recording, it'll be available on the Bloom Center website. Please note that you are in listen-only mode. Everyone's cameras and mics have been disabled so that we can see and hear our guest speakers. If you have any questions for our guest speakers, please enter them in the chat. We will have the time for them after the presentation. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, after the session, please take a moment to complete the survey, which will be provided in the chat. And your feedback is important to us as we plan for future programs. So, just a little introduction about our speakers tonight. We have Michelle. She is a family nurse practitioner specializing in obesity medicine and bariatric surgery. She joined MBH in 2023 to create a collaborative clinic between the Weight Center and Transplant, which opened last year, called Frontier Obesity and Nutrition in Transplant. Michelle helps individuals living with obesity optimize their weight and health to prepare for transplant and improve their health long after transplant. Michelle also supports bariatric surgery clinics by providing anti-obesity medication support to patients after the bariatric surgery. Kayla joined MGH Weight Center in 2023 as their first nurse practitioner specializing in obesity medicine. Her passion for obesity management, combined with her background in gastroenterology, has been instrumental in helping patients successfully initiate and maintain GLP-1 injection therapies. Beyond the clinic, Kayla actively advocates for the field of obesity medicine by co-authoring journal articles, participating in interviews with local media, and serving as a lead resource for other advanced practice providers, and educating both patients and healthcare professionals to improve access to these life-saving medications. They join us tonight to give a talk on GLP-1 side effects. Where do they come from and how can you manage them? Please join us in welcoming Michelle and Kayla.
Excellent. Thank you so much, Luz. Hi, everyone. I'm going to start off our chat today. I'm Kayla, one of the obesity medicine nurse practitioners for the MGH Weight Center. Hope you guys can see my slides now. All right. So, as mentioned, our chat today is really going to be focused on common side effects with these medications that you could run into when getting started, when remaining on them, and how a lot of times they can be avoided by understanding how these medications work and certain things that are going to be more likely to cause these symptoms. Right. So our agenda for today, we'll have a little bit of an introduction to the GLP-1s. We'll talk about why these side effects do occur, little tidbits on how to manage different side effects, and when you should be a little more concerned reaching out to your primary care, going to an ER and urgent care, how long side effects can last for, what to do if you miss doses, and setting yourself up for success. And we'll leave time at the end for you to be able to ask questions. So GLP-1 receptor agonists are injections that are FDA approved to treat obesity and type 2 diabetes. And each agent has a weight loss name and a diabetes name for the exact same medication. So liraglutide is injected daily. The brand names for that are Saxenda and Victoza. The medications injected weekly, we have dulaglutide or Trulicity. We have Wegovy and Ozempic, which is semaglutide. And then we have Zepbound and Mounjaro, which is tirzepatide. Zepbound and Mounjaro are our dual receptor agonists. So yes, they're GLP-1s, but they also have a second component called GIP. When we combine these medications with a reduced calorie diet, increasing physical activity, they can improve blood sugar, promote weight loss, and they have a whole host of other health benefits that are being researched, and more information comes out every day. I will say right off the bat that sadly in the United States, insurance does dictate a lot of our care. So often your insurance will have a medication they prefer to have you start with. And there is also medications that are better for different types of health conditions. So if there is an FDA indication for a certain health condition that you have, it might be a better choice to go with that agent rather than a different one. And these are all discussions that you'll have with your provider. So let's talk about how these medications work. So a GLP-1 is a type of hormone messenger that your body actually already makes in response to eating a meal. It works on the brain to decrease your hunger. It works in your gastrointestinal tract to slow down digestion. And in your pancreas, it improves the insulin use that you already have. But the GLP-1 hormone that we make in our bodies gets broken down very quickly. So you don't get to feel these effects long term. The injections mimic that hormone messenger, but it's made to last in the body longer so you can feel that full effect. And that is what often helps decrease hunger, help you feel full longer. It also is what can lead to certain side effects. So why do these side effects happen? So what we know about GLP-1s, they work on your gastrointestinal tract. That is one of the main areas they work. They slow down the movement of your gastrointestinal tract top to bottom. So if things don't move through as quickly, you feel full longer, you get full more easily, but that means you'll end up eating less. You'll take in less nutrients throughout the day. And when food sits in your stomach longer, when it sits in your bowels longer, that can lead to symptoms like heartburn, upset stomach or nausea, bloating, changes to bowel habits, and that could be constipation or diarrhea depending on the person. When you're eating less nutrients and your body has less energy, that's why people can feel sometimes fatigued, and that's why you can have areas have some hair thinning, nails thinning, skin can be dry. A lot of these are temporary and your body adjusts over time, especially as your weight stabilizes, but this is the start. So one of the most common side effects that we'll hear about being on these medications is nausea, and then in more extreme cases, vomiting. That comes from the slowing of the movement of your gastrointestinal tract. Food is going to sit in your stomach longer. Now, there are certain food triggers that are going to make this more likely to happen. Foods that are higher in fat content or much higher in fiber content leave your stomach slower when you're not on medication. So when we combine that with a medicine that slows the pace your stomach empties, it can double down. So foods with a higher fat content, anything greasy, oily, fried, fatty, red meats, larger volumes of salads, those really high raw fibers, are going to sit in your stomach like a rock, and it can make you feel uncomfortable. Other triggers for nausea, not keeping hydrated. Having good amount of fluid intake helps things move through your system more easily. It actually can be a significant trigger for nausea if you're not keeping up with your fluids. Your gastrointestinal tract is a tube from top to bottom. So if it's blocked at the bottom, the food up top has nowhere to go. So managing constipation is also a really important factor in decreasing chances for nausea and vomiting. When I talk about food triggers, so the foods higher in fat content, acidic foods, it doesn't mean you can't have them at all, right? I don't want to say no one can ever have a burger or a slice of pizza again. You just want to have a smaller amount earlier in the day. And then understand, especially for the weekly injections, the medicine's going to be strongest in your body for the first few days after you inject. So if you are someone where you guys have a pizza night in your family, maybe save that pizza night for the day before you're due for your next injection when the medicine is lowest in your body and less likely to have these symptoms. And then you want to make sure you give your body enough time to get that food out of your stomach before you're trying to lay down to go to bed at night, right? You want to make sure you're giving yourself at least 3 hours before trying to lie down to sleep for food to leave your stomach and move through your digestive tract. So that way it's not sitting there churning all night long. It doesn't have gravity helping move things along. And when you don't do this, this is what can lead to people waking up feeling very nauseous in the morning, feeling their stomach feeling unsettled. Some more natural and herbal remedies for nausea and vomiting: ginger is really helpful. Now, ginger ale sadly does not have a ton of ginger in it. So ginger chews, candies, teas tend to be a little more effective. If you're having more significant nausea, so you know you're being careful with your food triggers, you know you're being careful to not lay down right after eating, there's a lot of overlap between nausea and acid reflux. So a lot of times taking an antacid can actually be pretty helpful. Some over-the-counter options include famotidine, which is Pepcid. That's a good option for an as needed, for a rescue, because it kicks in within about 30 minutes or so. And you can take it up to twice per day. If you're having nausea more regularly or heartburn more regularly, more than 2 or 3 days out of the week, you really should move to a preventative medication like a Prilosec or an omeprazole. If you do choose to do that, make sure your prescriber knows, because if we are unable to get you off of those antacids after a few months, there's some monitoring we're going to want to do to make sure there's nothing else going on. Another strategy, if your nausea is a little bit more significant, it's not felt a little queasy here and there, you might need to repeat the same dose. So with all of these medications, we start at the lowest dose and we build up over time. That's to build your body's tolerance to get up to the effective weight loss doses. But for people who are really sensitive to medication, they often need to repeat lower doses longer. Some are unable to go up higher and they have to remain on a low dose long term. Others just need an extra month or two at a certain dose before proceeding. We need to listen to what your body tells us. Each person is an individual and you need to be treated that way. Okay. Now, for really severe nausea, and you may have experienced this for other reasons in the past, there are prescription nausea medications like ondansetron or Zofran. However, those really should be rescues for extreme cases. If you're having difficulty keeping fluids down because the nausea and the vomiting is so severe, we do not recommend using Zofran to stay on this medication. There are side effects and consequences to regular use of Zofran, where it's just not recommended. It's not worth the risk with these medications.
Thank you for walking us through the top, Kayla. I am Michelle, nurse practitioner, and I'm going to walk us through the bottom. Constipation and bloating we'll start with here. So constipation is slow emptying of the bowels. Symptoms include only moving a small amount of stool or feeling as though you haven't emptied completely. So even though you have a bowel movement every day, you just feel like you didn't get everything out. Straining when you're trying to initiate a bowel movement. I tell my patients you might need a little nudge to get started, but if you're really bearing down and turning red-faced and pushing to get the stool out, that's constipation. Or missing a bowel movement altogether. Normal patterns of having a bowel movement vary considerably. So some people might have 1 or 2 comfortable and complete bowel movements every day to every other day, and that could be normal. But it must feel like it's complete, that you've gotten everything out, be soft and solid in texture. And, like I said, you can have 3 a day that are very small volume and you don't feel like you got anything out, and that could be constipation. If you're getting stools out that are very hard and lumpy, that's constipation as well. And so this can be really common with the GLP-1. So many patients do at some point develop some degree of constipation. So the first reason why is because the medicine, again, it's slowing down how quickly food is moving through the digestive tract from the stomach to the intestines and then finally coming out as stool. When we decrease how often we go to the bathroom, the body is going to pull more water from that stool. So it makes it harder and harder to pass. The second reason constipation happens is because when we start these medicines, we eat less, and often we eat less fiber as well. Fiber comes from fruits, vegetables, beans, legumes, nuts, seeds, and grains. It's very important to have in the diet. It gives stool extra bulk. It draws water into the stool to make it softer like a sponge and preventing it from becoming too hard, and it can speed up digestion. There are some instances, like Kayla had mentioned, if the stomach is really slow, where too much fiber is not necessarily a great thing, but not too much and not too little, a healthy balance of fiber in the diet can help keep things moving along. GLP-1 medicines decrease hunger naturally, so you eat less. And so when your fiber intake drops, constipation can be the result. Most constipation from GLP-1s can be easily treated, but the key is to act early because the longer you remain constipated, the harder it can be to get things moving again. So the first thing we do is we recommend looking at the types of foods you're eating. Make sure you're getting some fruits and vegetables, beans and legumes. We always recommend eating your protein first with every meal and then have a little bit of fiber with that too. Doesn't have to be a lot, but a small serving with every meal can help remedy the issue. The second thing we recommend is upping the water intake. So hunger and thirst come from the same appetite place in the brain. So if we're decreasing hunger on the brain, we're also decreasing thirst. Your body will correct this by absorbing more water from the intestines, and this also makes stools harder. So we want to make sure you're having the fiber to absorb the water and actually taking in the water so it can work. Now, if these things don't work, if you up your water and you up your fiber intake, we can add a fiber supplement, which is a little different than the type of fiber that we eat. So the fiber supplement is really nicely absorbed into the stool, and it can be a little bit better in regulating water balance. We recommend Benefiber or Citracel. Some other brands such as Metamucil might make bloating a little bit worse if you're constipated, so we tend to stick to the Benefiber or Citracel. We start very slow, just with 1 teaspoon per day for a couple of days, and then increase every week or so 2 teaspoons up to the max dose. You do want to make sure you're drinking a little extra water when adding fiber. There are gummy tablets and capsules that are available, but we do find that the powder does work better. And I will say the Benefiber absorbs really nicely into whatever drink that you're putting it in. So that can be very helpful. The next step is adding Marilac. So if you're adding the fiber, you're minding the diet, and you're still missing a bowel movement or having really hard stools or not getting everything out, we'll add some Marilac. And generally a capful a day at nighttime and mixed with the fiber can be used to help get the stools out all the way and make them feel complete. This can be continued long-term if needed. And if this is a strategy that you have to use, we recommend doing it for, a couple days to a couple weeks and then gradually weaning off of it. If you come off your bowel regimen too quickly, the constipation can come back again. So really take your time with this. Lastly, if constipation is very severe, we'll use an occasional Senna or Dulcolax, which is a stimulant laxative. It's really effective at getting the bowels moving, but if you use it too regularly, you can become dependent on needing stimulant laxatives to have a bowel movement. So we really recommend this if you haven't had a bowel movement in 2 to 3 days, you really need some relief. You can take one of those and then adjust your fiber and Miralax regimen. And of course, if it's getting very complicated, and sometimes it does, talking to your prescriber or your primary care about how to manage your bowels can be really helpful. And of course, really severe constipation, if it's associated with severe abdominal pain or vomiting, or if you're seeing blood, don't wait for those things to resolve. Please reach out to us so we can help you through it and assess if there's anything more serious going on. But for the most part, with some dietary changes, and fiber and a little bit more time, maybe on the same dose, the constipation does start to improve. Okay. And diarrhea, so the opposite of constipation. We occasionally see diarrhea with these medicines. Diarrhea is described as unformed or liquid bowel movements that usually will occur more than once to twice per day. It's not a normal bowel pattern. It is less frequent of the side effects of all the medicines. It is more likely to occur with the tirzepatide, which is the Zepbound or Mounjaro. Because it's less likely to occur as a side effect, we want to know. So we want you to check in with us if you're having diarrhea. It's very common to pick up a mild gastrointestinal virus or bacteria out in the community. If you're out at a restaurant, maybe you ate something undercooked or that was a little suspicious. You might have a family member who had similar symptoms. Usually after a couple days with some hydration and rest, this will resolve. But if it persists longer than a few days, we might want to order some stool tests because there are some bowel infections that do require treatment, and we can diagnose that with a stool test. So definitely check in with your prescriber if this is an issue that is persisting. Often medicines can also cause diarrhea and some supplements. So if there's no infection, we might look at your medicine list to see if there's anything else that could be contributing. And if we don't find anything, interestingly, we use our friend fiber also to treat diarrhea. Benefiber Citracel, again, helps regulate that water balance in the intestines. They absorb that extra water and can make the stool more formed. For severe diarrhea, that's very urgent or prevents you from leaving the house, or if you're afraid to do things or have company because you're rushing to the toilet and you don't have an infection and fiber hasn't worked, we can try Imodium, which is available over the counter. It's 2 tablets in the morning and then 1 tablet up to 3 more times per day. We do like to rule out infection first though, so make sure that there's no bugs there that have to be run out. Pepto-Bismol can also be used over the counter, but it is important to know Pepto-Bismol might turn your stool black. So we know that it's not alarming to us and it's not a cause for concern, but we do get phone calls. Folks are on Pepto and their stools are black. It is certainly an alarming find, but of no concern. If you're having diarrhea with severe abdominal pain, fevers, vomiting, or blood in the stool, though, please don't wait for this to pass. Call your prescriber, your PCP, or maybe even visit an urgent care to make sure there's not something more serious going on. And next, hair loss. So we commonly talk about hair loss in our clinics. Any weight loss can cause hair thinning and hair loss, no matter how the weight loss was achieved. So whether it was surgery or medicines, it causes a phenomenon called telogen effluvium. And what that means simply is that the hair follicles enter a resting phase and temporarily do not grow new hair. Even when the weight loss is intentional, our body interprets this as a threat. So it prioritizes delivering nutrition and nutrients to essential organs like your heart, your liver, your kidneys, your brain, over growing a thick head of hair. Thinning skin and nails may also be seen as a result of this, and this might start 6 to 12 months after starting a medicine, but it is temporary and it will improve when weight is stable. Some may claim that biotin or collagen supplements are beneficial, but the results of these vary. And there are some prescription medicines like Rogaine that can help with hair regrowth. There's topical solutions and pills. We prefer the topical solutions like shampoos and foams because you can target the areas of concern, but pills can make hair grow all over the body, not just on your head. And again, that is temporary. Now, red flags. So very rarely there are some severe side effects of the medicines. They are not common at all. In fact, we infrequently see them, but they don't never happen. So like any treatment that we're starting, there are certain side effects or complications that should not be ignored. So some of the more rare side effects of weight loss, I would argue some gallstones is the most common out of all of them, but with rapid weight loss, any weight loss, you can develop a gallstone. Pancreatitis, which is inflammation of the pancreas. Usually folks that present with this have had a history of pancreatic inflammation. A blockage of the bowels that might be due to severe constipation or pre problems with the intestines that existed even before the medicines, and severe changes to mood and behavior. They're not common and they need to be addressed immediately. So if you experience uncontrolled nausea, vomiting, you can't keep food down, you're constantly retching and throwing up food, you need to be seen. Severe abdominal pain, doubled over, can't move. If you have thoughts of wanting to hurt yourself or end your life, or if you have severe constipation going more than 7 days without having a bowel movement, you do need to have these symptoms evaluated in the emergency room without delay. And so bottom line, these symptoms these are alarming whether or not you're on GLP-1 medicine. So if whatever side effect you're having would normally concern you, you shouldn't change your mind about going to the emergency room just because you're on the injections. They're not common and they do need to be addressed. Now, when people present with side effects or when I talk to patients about troubles they're having on their medicines, they're, concerned, is this going to last forever? Will I always feel like this on the treatment? And the answer for almost everyone is no. We reassure people that most of these side effects improve or go away over time as you get used to the medicines. We find the longer someone's on a medicine, especially the maintenance doses, the side effects taper off over time. That might just be because of improved tolerance to the medicine, or maybe we're doing something to help you through those side effects, helping you move your bowels more, managing your constipation, changing how you're eating. It's important to listen to your body. If you're experiencing a side effect that's bothersome, speak up. Our goal is not to make you feel worse. These medicines have so many health benefits, and we want people to be successful in maintaining long-term results that benefits their health and reduces their future health risks. And we intend for patients to be on these medicines for a very long time to control their disease of obesity. So if you're having trouble, your prescribers are usually full of advice and tricks to help make the symptoms better or to reassure you that they're going to get better over time. Or we might be able to recommend another treatment that could be better tolerated. Sometimes we have to make a medication switch. Our goal is to help you manage your health and feel good. So you have to be comfortable with working your prescriber to help manage any of these side effects so you can be successful. Now, gaps in treatment. So we do, unfortunately, we encounter this quite often. So there's some circumstances where we must stop the medicines. Less likely, but sometimes it's for a surgery. If you're a woman and you become pregnant, we stop the medicines during pregnancy. But these medicines require a prior authorization, which is an agreement from your insurance company that they're going to pay for the medicine. Unfortunately, these prior authorizations need to be reviewed sometimes as frequently as every 3 to 6 months or out to a year. But oftentimes what happens is patients will go to the pharmacy to fill their medicines and they're told that their prior authorization is expired and their medicine is no longer covered. Now, the prior authorization process can take up to 1 to 3 weeks. So if it's not requested in time, you might not have coverage for your medicine and miss doses. That's the most common reason we see a gap in treatment. If these situations occur, it's very important that we know what medicine you're taking, what your last dose was, and how long it has been since your last dose. Depending on how much time has passed, your dose might have to be temporarily reduced to prevent severe side effects. Again, we build the medications over time. You start at the lowest dose for 4 weeks or a week, depending on if it's a daily or weekly medicine. And then for most of the medicines that people are on, each month we're increasing the dose again for another 4 weeks. So if you get to a higher dose and you miss more than a dose or two, then restarting that same dose might be too much medicine for you, and you might be at risk for having some really severe side effects. So we need to build that tolerance again. So it's very important to reach out to your prescriber for guidance if you're on a higher dose and you've missed more than one, to figure out how to resume taking your medicine safely, to know if you need a dose adjustment. And you can be advocates for yourself for preventing gaps in treatment. When your medicine is approved, you'll have an expiration date on your prior authorization letter. It's a really important date to put in your phone and put an alert about 3 weeks ahead of time, so you can call your prescriber's office and tell them, hey, I'm going to need a new prior authorization in 3 weeks. Can you get that process started for me? And that's a great way that we can prevent any gaps in care. So setting up for success. I start lots of people on these medicines. They're wonderful medicines and they have tremendous health benefits, but they do require developing healthy habits for maximal results and minimal side effects, so you can stay on treatment long term. Remember, they slow digestion. So overeating or eating very heavy meals, those fried, greasy meals, or skipping meals can all affect our digestive tract and how well we can move food through our intestines. So it's very important to mind what you're eating and when you're eating it. Also, when you lose weight, you don't just lose the fat tissue that people want to lose, but we also lose muscle mass as well. So it's very important that we supply the body with the nutrition and activity it needs so that you can maintain your strength and gain all of the health benefits of these treatments. So when I start my patients on these medicines, we talk about these essential habits they can adopt to be successful. So first, for nutrition, eat 3 meals a day and don't skip meals. I don't care if it's just if you're really nauseous and battling through some of these early side effects, don't skip a meal. Have something really small. Keep the regularity going with your meals. Your meals should primarily focus on having a protein like egg, cottage cheese, yogurt, lean meats like chicken, turkey, um, uh, nice cuts of meats that aren't marbled with your meal first, and then couple that with some vegetables, nuts, seeds, beans, and legumes, those fiber foods, to get all of the essential nutrients you need. So by eating these foods first, you'll have less hunger and desire for the more savory foods like chips, baked goods, and sweets. Keep your hydration going. Remember, appetite and thirst live in the same place of the brain, and so you're not going to be as thirsty. So it's helpful to have a big water bottle or a reminder that you have to drink through the day. We recommend 64 ounces of water or 8 glasses. And consider taking a multivitamin to support vitamin needs. Your nutrition will be greatly lessened on these medicines, so sometimes it's helpful to take a multivitamin. When you're eating, so behavior, when you're eating, there's a delay between when your stomach is actually full and when you might no longer actually feel hungry. So usually the stomach fills first, and then it takes a few minutes for the rest of your body to catch up and say, hey, I'm full. So when you're starting to feel full, when you're feeling comfortable and that hunger goes away, that's a good time to slow down eating or maybe stop altogether. Have a glass of water. If 10, 15 minutes goes by and you're still hungry, you might still be hungry. But if you're comfortable and you do feel satiated by your meal, you can wait until the next meal so you don't overeat. And like we talked about, overeating can worsen side effects. So you have to pay attention to those hunger cues and how they're changing. Other tricks to slow down eating are to take smaller bites, use smaller plates, and eat meals at the table. Taking meals on the go or while distracted, such as watching a TV program or at the computer or on the phone, often leads to overeating. And typically the snacky foods like chips, crackers, sweets, some of those heavier foods that might contribute to more side effects. We recommend 150 minutes a week of regular activity. Again, activity is really important to preserve your strength and your muscles and bones while you're on these treatments. This might be 30 minutes 5 times a week or 10 to 15 minutes twice a day. This could be a walk, a bike, a swim, or any activity that moderately increases your heart rate and breaks a little sweat. You should work hard and be mildly uncomfortable. If you don't work out at all, we just recommend starting with a 10-minute walk every day to get in the habit and build your endurance and strength gradually. We do recommend 2 to 3 sessions of strength training, like lifting weights, body exercises, or resistance training. There's a ton of self-exercise videos online that you can do at home, and most gyms have trainers that can show you how to get started. Some employers or insurance companies may have wellness benefits that cover a portion of gym fees. And like we've talked about in this presentation, listen to your body. If exercise feels really foreign or you're not sure if it feels safe, reach out for help. Certainly, if you're very uncomfortable or feeling dizzy or having pain when you're exercising, stop and talk to your prescriber about who to connect with to exercise safely. And then lastly, sleep. I think there's a lot about sleep, but we don't often talk about it in medical clinics enough. And it's so important to be getting a restful night's sleep. Your body's like a computer that needs rebooting. So every night when you sleep, your body and all of its tissues repair itself. Getting a full night's sleep can lift your mood and makes us more likely to stay motivated and keep up with healthy habits. So setting your space up for success includes going to bed in a cooler room that is dark, avoiding using phones, tablets, or before bed. And if you're finding it hard to fall asleep, start by trying paper puzzles or reading books. Waking up at the same time every morning can also help maintain a good sleep schedule. And so usually if we can I don't expect all of my patients to be perfect in every one of these areas when we start these medicines. We usually pick 1 or 2 habits that my patients feel are very important, or they feel like, I could really improve this or that or the other thing, and we work on those, and then we build habits over time. So with that, we thank you so much for taking the time to listen to us and take the opportunity to really be in charge of your health. We know how hard everyone works to live a healthy and meaningful life, and we're so grateful to be able to help people along the way and truly love what we do. So we are happy to take any questions. Thank you so much.
Okay. So one of the questions in the chat asks, how do you know if you need a higher dose of Monjaro? If I'm doing well on my lower dose, is there any reason to increase the dose?
That's a great question. So there's a couple factors we keep in mind there. And sadly, insurance does come into play with this a little bit as well. So if a medication is working for you, if you're losing weight, if it's controlling your appetite, and that's your aim, no, we don't necessarily need to increase. You can repeat a dose from a clinician standpoint, right? Lowest effective dose I'm happy with. Things that can impact that decision, though, so less with Mounjaro because it's a diabetes agent, but sometimes with the weight loss injections, there's transition doses and then there's long-term use doses. The transition doses, insurance really is only going to let you fill 2 or 3 times per year max. And then after that, you either have to move up or they're going to kick you off the medication. They won't cover it anymore. And this is sadly where insurance gets to dictate your care sometimes. So for Wegovy, the transition doses are the first 3. So the 0.25, the 0.5, the 1, they'll let you use a few times, but you have to get up to 1.7 or 2.4 to be in those maintenance doses that they'll cover long term without giving you a lot of pushback. When you get up to those doses, from there, your insurance criteria is really you have to lose 5% of your starting body weight and maintain that 5% weight loss, which for most people is around 10 to 15 pounds and not hard to do. With Zepbound, your transition doses are your 0.5 doses, and this is the same for Mounjaro. So 2.5, 7.5, 12.5, insurance can limit how many refills of that you get per year. They want you to land on the FDA-approved long-term doses, which are 5, 10, or 15. So typically what I encourage my patients is hang out on a dose that's a long-term use dose. So if you're on 5 and 5 is working, awesome. You can stay on 5 forever. If we're talking about moving up, we have to anticipate, okay, yep, maybe we'll go to 7.5 for a few months, but we do now have to either land on 10 or go back to 5.
And the weight loss on these medicines, they don't end at 4 weeks. So we start these medicines, 4 weeks goes by, you lose some weight, you check in with us after a month or two, we make sure you're tolerating it. But really the weight loss keeps going, maybe out several months on certain maintenance doses. And this depends on the person. So, in addition to that, we're looking at, appetite suppression, control of hunger, maintenance of weight. Do you feel like you're at a plateau? Is hunger creeping back in again? And then are there certain metabolic markers that we're looking for, right? Is sugar still really high? Is the cholesterol still out of control? Is blood pressure still really high? So we're looking at, not just the weight on the scale, but we're looking at all of you and where you need to be to really improve your health.
Great, thank you both. And one more question is, the biggest side effect the person is having is fatigue. So do you have any suggestions?
Yeah, absolutely. So fatigue more often than not, whether it's conscious or subconscious, can be a side effect of your behaviors. And I find for the majority of my patients, it kicks in that first day or two after injecting. That's when the medicine is the strongest. And if you're not paying attention to your eating habits and your drinking habits, you might be unintentionally dropping your dietary intake, dropping your fluid intake pretty significantly, and then your body doesn't have the energy it needs to function, right? And it's going to want to make you sleep. I do find that fatigue seems to be a little bit more common with semaglutide compared to tirzepatide. So I think there is a little bit of extra to that with the Wegovy or Ozempic, that you feel tired for a few hours after injecting. In that situation, my suggestions usually do your injection in the evening. That way, if you're tired, you go to bed. And pick whatever your day of the weekend is. So if you have a lazy Saturday or a Sunday, it's not the end of the world. Other times being aware of your dietary intake, so improving your protein intake, improving your fluid intake. And then some people, they really find benefit from using a multivitamin to give them an extra nutritional boost, especially during these weight loss phases.
Completely agree with that. Thank you.
Great. Are there any more questions someone might want to drop in the chat? Well, I have a question. Do patients typically experience any change in their taste or preference in food while they're on the treatment?
They can. I hear a lot more in change in preference of food, which is really interesting how these medications can alter our brain chemistry and those food craving and desire centers. So people do report that sometimes they might have been like, oh, I've had this awful sweet tooth my whole life, and now couldn't be less interested in it. I want protein, I want vegetables, which is really interesting to experience. And it can be a powerful thing to experience because so much of our cultures revolve around food. And there can be a little bit of an emotional loss if you suddenly have a decreased interest in a food that's really, say, important to your family culture. So being aware of that. I hear less about different specific tastes. If there's usually a taste change, there's usually something else going on. Like if you're waking up with a bitter taste in your mouth, I wonder if you're having acid reflux that you might not be feeling typical symptoms of. I have very, very rarely heard about people feeling like they have a metallic taste in their mouth, but that is fairly uncommon.
Yeah, I would agree. Most of my patients are really just shocked that they don't crave the food that they were normally snacking on, right? So they're stopping at rest stops or stopping at fast food places, really craving that heavy, savory food, and they come back to see me and they're like, I just don't want it anymore. I don't think about it. I could care less about it. And I think for a lot of people, it can be really liberating, right? To be able to make the choices you want to make to be healthy. So in general, the food preference changes are very positive.
Okay, perfect. Well, since there are no more questions in the chat, I do want to give A big thank you for your presentation today. I feel like information is very important, especially since it's a hot topic right now. So thank you, Michelle and Kayla, for your presentation today.
And also
Yeah,
thank
thank you for
every-
having us.
Oops, so sorry. Also thank you everyone for coming in. I'm just dropping the link of the survey in the chat one last time. So if you have any feedback for us, we would really appreciate it. Other than that, anyone with any last minute questions? Well, if not, I think we are good to wrap up.
Thank you.
Thank you, everyone.
Awesome. Thank you. Have a good night,
Take care.
everyone.
Bye-bye.
Bye bye.